Hey everyone, it's Dr. Cassidy from CHIRO for Chiros, CHIRO for Moms, CHIRO for Kids. I am a prenatal chiropractor here to talk to you about the treatment things you can do to make your adjustments go better with your prenatal, your pregnant patients. Thank you for being here. Without further ado, let's just dive into these treatment tips. First and foremost, I never want you to forget about the benefit of incorporating soft tissue work into your treatment. And it's far beyond just what the soft tissue care can do for pain relief for your pregnant patients. It's also related to patient comfort and getting muscle tensions to relax before we go and try to adjust. So oftentimes for us, this looks like some sort of pin and stretch of a tight muscle. The very fun and cool thing about pregnancy is that it's oftentimes the same muscles, even for different patients, because they're all dealing with the same mechanical and hormonal changes. So we really target those muscles that tend to be tight and be causing the muscle tension. That way, the muscle tension isn't going to impede how well the adjustment goes. I mentioned we use pin and stretch. We also utilize warm stones in our clinic. It's a sneaky way, yes, to incorporate more soft tissue work. Also a sneaky way to incorporate more of an elevated, relaxed feeling for our patients, which if you're a cash practice, you know that's important. So utilize soft tissue techniques. It can honestly be anything as long as your patients enjoy it and it's effective at reducing muscle tension. So along those same lines, something chiropractors often forget about is that activation and mobility drills are just as important as stretching. So oftentimes in our clinic, for most patients, we are going to incorporate these activation and mobility drills after the treatment. It's going to be the final thing that they leave with. This is because we want it to be fresh in their heads, because it's oftentimes the same exercises and the same drills that we are giving them as homework for, pain relief. We want them to be doing these exercises at home, so it's great to end with them. However, for some people, you are going to get better results if you have them activate certain muscle groups before you adjust them. So let me say a little bit more about that. From my personal experience, and of course this varies, if a patient is someone who has a lot of muscle tension or muscle restriction in their body, they are just generally a tense person, but they are not necessarily very active. Maybe they are stuck at a desk job all day, but they still have all this muscle tension as if they are an incredibly, active person. Those are going to be the people that, in my experience, are going to benefit most from utilizing activation and mobility drills before we adjust. So some examples of this: activating the glutes and the pelvis simply with some glute bridges before attempting a side posture or any sort of pelvic adjustment can be really helpful. For the low back, you can incorporate certain core exercises. Even a bird dog is super quick and simple to instruct. But honestly, you can do this for any region of the spine. Activate these certain regions and your adjustment's going to go better. Like I said, it might also look like a mobility drill. In my experience, mobility works a little bit better when we are talking about extremity joints. Activation works a little bit better when we are talking about spinal regions. And finally, the third and maybe the most important treatment tip I am going to give you is have multiple ways to get your job done. And that, of course, goes for generic pain relief. That's why it's also important to incorporate different modalities, soft tissue techniques, you name it. But it's really important that you have more than one way to adjust, let's say, a pelvis. You have more than one way to adjust the neck, the thoracics, the lumbar spine. Having more than one way to get the job done is essential for, I'm going to say, all chiropractic care, but especially during pregnancy, because adjustments are not one size fits all, and they definitely do not work the same for a pregnant patient versus someone that is not pregnant. So, examples for you: in our clinic, we actually have 4 different ways we can adjust the low back, which is frankly pretty impressive. We are able to adjust a pelvis in side posture. We're able to adjust a pelvis using a drop piece. We also have an activator, and we have a flexion distraction table, which counts as an adjustment because you are physically increasing the mobility of those spinal segments that you are working on. So, multiple ways you can use this across all regions of the spine. You need to be able to adjust cervicals, seated and supine, and with an activator. You need to be able to adjust thoracics, anterior and prone, and maybe even standing, in order to have all the tools you need, because every patient, especially every pregnant patient, is going to need something a little bit different. Those are the 3 big tips that I have for you this week on treating pregnant patients with chiropractic care. If you have any questions, make sure you drop them in the comments. And if you are looking to enhance your treatment skills with the pregnant and postpartum population, you need to check out our online course. We go over all the most common musculoskeletal complaints. We break down the common causes, the hormonal and the biomechanical changes that happen in a woman. And then we also treat you all those different ways to adjust safely and effectively. So if you're looking for that, the link is below. And of course, subscribe and stay tuned for more.